91.3 FM in Sonoma. This evening's town hall is being presented on all our platforms, including Sonoma TV, Comcast 27 in the Sonoma Valley, sonomatv.org, the Sonoma TV channel on YouTube, and KSVY 91.3, as well as streaming on ksvy.org and on your home, Alexa, Google, or Apple device. Senator Dodd represents all or part of 6 North Bay counties, including Napa, Sonoma, Solano, Contra Costa, Sacramento, and Yolo counties. This is the latest in a series of virtual town halls Senator Dodd has held in partnership with KSVY Sonoma Radio TV during the COVID-19 pandemic. Tonight's town hall features Lori Najura, the Deputy Director of California Department of Emergency Services, Jason Elliott, Housing and Homelessness Consultant to Governor Newsom, and Lourdes Castro Ramirez, Secretary, California Business, Consumer Services, and Housing Agency. After our panelists talk, we will present the panel with questions we have received by email, and we will open the KSVY switchboard and take your questions. I will give that number shortly before that time, so as that we don't jump the gun here. And now for our opening comments with Senator Dodd. Good evening, Senator.
Well, Rick, thank you very much. This is our 7th town hall since the COVID crisis on KSVY. We appreciate all the great efforts of you and your team there. I know we're hearing some feedback and we're understanding that perhaps that will be corrected. I apologize in advance for that, but I really would like to thank our panelists from KSVY for convening this latest in a series of town halls tonight. Housing is a critical issue. I'm very, very glad to be joined by this distinguished group. And thanks to the hundreds of people tuning in tonight, you shared your concerns with me, and I want you to know I have heard you. In California government right now, the focus is on containing the coronavirus pandemic, getting as many people as vaccinated as possible, shoring up our economy, and addressing the housing and homelessness crisis that has been exacerbated by this pandemic. As a legislature, this is a top priority. I am meeting these challenges head on. Fortunately, they're good news. Our statewide infection rate is dropping. And after a slow vaccination rollout, we're now administering more than 1 million vaccines per week. Close to 5 million vaccinations have been administered so far in California. I expect this rollout to get better and better as we go on. Sooner or later, everyone will be inoculated. But unemployment and a partial shutdown of our economy continues to weigh heavy. One area that is hard hit, of course, is housing. The crisis that existed before this pandemic has worsened, with people at risk losing homes because they can't pay rent. Small landlords face foreclosure. Governor Newsom and the legislature have responded by enacting tenant protections. We recently extended the moratorium on evictions for people affected by the pandemic to June 30th. And there are several other key steps the state has taken to address the affordability crisis and homelessness in general. Here with us tonight are 3 people working on the front line on all these issues. I'm pleased to have on my panel Lourdes Castro Ramirez, the Secretary of the California Business, Consumer Service, and Housing Agency. In a moment, I'll ask her to talk about the ways her office is assisting with this pressing issue. Also with us tonight, as you heard earlier, is Jason Elliott, the Senior Housing and Homelessness Counselor to Governor Gavin Newsom. Jason will talk about all the things the administration is doing in this housing space. But before they talk, let's hear from my third panelist, Lori Najura, Deputy Director of Planning and Preparedness and Prevention at the California Office of Emergency Services. Let me just give you a little editorial. This department has absolutely been unbelievable for all the fires, the pandemic. I mean, Lori, I just can't even believe how your department has been pressed into service so many different ways over the last 2 or 3 years. And I, for one, am really pleased at the job that you're doing, and you're going to give us an update on the vaccine rollout and how our state is doing in the battle against this deadly pandemic. Go ahead, Lori.
Thank you for the kind words, Senator, and thank you for inviting me here today. And I'm very pleased to be here with the good people of Sonoma to talk about the state's vaccine rollout. And I know that there has been talk about it being a slow rollout, and there are various sites that rank the states on administration, and for a while, California was quite low. Keeping in mind that we have the highest population in the entire nation, we are working on multiple fronts to increase our rank and our number of doses administered daily. And I'll just share, Senator Dodd did kind of let the cat out of the bag. Today we hit a huge milestone. We hit that 5 million mark, yay. And we're at about, we vacillate between 63 and 73% of the doses that we've received in the state are administered. There's been a couple reasons why that percentage is so low. Our actual number of doses administered far exceeds any other state. I think we are about 1.3 million more doses administered than the next closest state, which is Texas. But that doesn't mean that we don't have to continue striving to move up that ranking and to do a better job of vaccinating the people of California. Well, there's been, Governor Newsom put a task force in place to take a look at the vaccine operations and identified 3 areas where we needed to do better. The first was clearer information to the public. With 61 local health jurisdictions, plus additional health systems that operate across jurisdictions, it's been confusing for Californians to follow changes in eligibility and appointment availability. So we've done a couple of things. One is that we are transitioning to a more simplified manner of determining eligibility. We had kind of embarked on this road of prioritizing sectors of essential workers, starting with healthcare workers, including long-term care facilities, staff, and residents. And after that, we had identified some other essential worker categories, such as emergency services, food and agricultural workers, and teachers and school staff, as well as childcare. These groups having the highest number of individuals who were at risk for exposure, and the societal impact of exposure among these groups was considered very high. Well, it's been confusing. So after this, we're switching to an age-based system solely. And that's starting with age 65 and above. So right now, if you are a healthcare worker, if you are a long-term care staff or resident, if you are 65 and above, if you are an emergency services worker, teacher or childcare worker, or school staff, or a food and agricultural worker, you are eligible for a vaccine. Well, you may be saying, I'm one of those, but I can't get an appointment. And that's because we are still in a scarcity of vaccines. So there's a couple other things that the state's doing to try to increase that ability for you to get your vaccination. We've awarded $17.3 million in community-based organizations to conduct outreach to communities disproportionately impacted by COVID-19. This is supporting community those disproportionately impacted populations in order to encourage them to get vaccination. These community-based organizations have been providing critical services, and they're going to be our key partners to try to get you and others to those vaccination sites and to your providers to get a vaccine. And I'll talk in a few moments about some other things the state is doing to increase your opportunities. The other area that we noticed needed some help was data collection and management. So we've gotten a third-party administrator to come on board and help us to work through that, the data collection through the provider networks. So that is improving as we speak. We've also created a unified statewide network called myturn.ca.gov. It's available right now to every county in the state, but the scheduling component of it is still only live in a couple counties. We're in the process of onboarding all the rest of the counties, so by the end of this month, you should be able to go to myturn.ca.gov, put in your information, find a clinic near you, and schedule an appointment. And then the third area, and this I've already mentioned, this is a big area, is just the vaccine supply. We need the vaccine supply manufacturing to ramp up at the federal level. We were promised in the former administration increases in vaccine supply that didn't materialize. But from the moment that the Biden administration came into the office, they've taken several steps to increase that, and we have seen our state allocation go up. Not as much as we'd like, but it is going up. So some of the things that we're doing to increase the amount of vaccine, what we call pods, places where you can go to get vaccinated. We're working with counties to set up what's called OptumServe sites. OptumServe helped us out with a lot of testing sites, and now they're switching over to vaccine. And I think Sonoma has one of the first OptumServe sites that was set up. We also have a couple of federal and state sites in the state, and the federal government is bringing in vaccine for that, so it doesn't impact our state allocation. That's a huge win for the state of California. And we're working on 2 more sites. In addition to those 4 total sites, we'll have mobile units that'll be able to go out into the community and vaccinate at places of employment, at community centers, mobile home parks, and various other places. The federal government's also turned on the federal pharmacy program, and it's a collaboration between the federal government, states and territories, and 21 national pharmacy partners and independent pharmacy networks. So beginning on February 12th, this Friday, select pharmacies will receive vaccine direct from the federal government to vaccinate eligible populations in California. Here in California, that is Rite Aid and CVS. Now, it's, again, vaccine is limited. So right now, the rollout is in just a couple stores in each county, but that will grow as the vaccine supply grows. There's probably a lot more I can say, but you have excellent panelists here that you want to hear from. I will wait for the question and answer. And again, I do want to end with this. It'll take some time to reach herd immunity. So we're asking for your patience, and we're asking that you continue to wear your masks, continue washing your hands, and keep physical distancing. For more information, check out the Vaccinate All 58 campaign at covid19.ca.gov, and go check out myturn.ca.gov and sign up for notifications about when you'll be eligible to be vaccinated. Thank you, Senator.
Thank you very much, Lori. Well done. Now we're going to turn to Jason Elliott, and Jason is a senior housing and homelessness counselor to Governor Gavin Newsom. Jason, thanks for all your work on behalf of the state of California. I know that's a huge job, and I appreciate you being able to be here tonight with us to kind of fill us in on what's going on with your programs.
You got it. Thank you, Senator. Let me just start by saying I appreciate you creating a forum where we can talk about this issue, right? Because homelessness is on the mind of so many Californians, and it's an issue that's easier to not talk about. But if we want to make progress on it, I think it's important that we create venues like this and we answer hard questions from our constituents. So let me just start by saying, Senator, I appreciate that you're making the space for this conversation. I'll try to be brief in my comments, and I imagine there'll be a number of questions that come from your constituents and the audience here on this issue. Homelessness was a major challenge for California before COVID, and it's going to be a major challenge after COVID. So what did we do during the pandemic to try to address this? And I'll just spend a minute talking about two programs that we're really proud of in the administration. One is called Project Roomkey, and the other is called Homekey. And Senator, I know you've been a supporter of both of those, and so I want to thank you for your leadership as well. So here's what we did. Pandemic hit us really right in the face in March. And at that time, we were scrambling to try to do everything we could to protect Californians. Our homeless neighbors are some of the most at-risk, vulnerable people in our state. So the question is, what are we going to do? Are we going to step up and meet the moral challenge to help those individuals? It's not just a moral challenge. It's also about protecting our communities and protecting our hospitals. If a homeless individual gets COVID, that homeless individual has every right to a hospital bed, just like you or I do, or the secretary does, or Lori does. So we want to try to keep as many people from getting sick as possible. Of course, our homeless neighbors are living in tents or in shelters and really unable to social distance, really unable to access hand washing and regular laundry services. So what are we going to do about that? And that's how Project Roomkey was born. Project Roomkey, if you follow the issue, you sort of know about it. If not, I'll give you a real quick version. It's all these hotels and motels, and Lord knows in your part of the state, you got a lot of hotels and motels because you have a really robust tourism industry. They're all empty because nobody's traveling early in the pandemic. So what we do as a state is we lease them from the hotel owners, and we place people experiencing homelessness into those hotels. We do that, number one, to protect the individuals from contracting COVID out in the encampments, but also we do it to protect the rest of the Californians from the spread of that virus. So what has Project Roomkey done? Statewide, 16,000 hotel rooms, over 16,000 hotel rooms across the state at the height of the program. We have served in Project Roomkey 23,000 people experiencing homelessness, the most sick, the most at risk, the most vulnerable in our communities have been provided these safe isolation and quarantine rooms. Before we started this town hall, I was just taking a look at some of the counties that you represent. I'll just give just for the sake of order of magnitude to understand. Sonoma County, 133 rooms in the program. This is right now. There were high watermarks that were higher. 133 rooms, Sonoma. Napa County, 111 rooms. Yolo County, 183 rooms. Solano, 137 rooms. And there's many more around the state. A long way of saying, just in those four counties that I just mentioned, you got well over 500 hotel rooms providing safe places for the most vulnerable Californians to protect themselves from COVID. So that was one of the main things we did during this pandemic, but that's temporary, right? And the question is, how do we create permanent solutions for homelessness? And that's what Homekey is, which is the second program I want to touch on very briefly. Homekey is all about buying these hotels and motels, right? The Roomkey thing that I just described, that's leasing, temporary, FEMA, emergency response. Homekey is buying, creating permanence in this portfolio. Well reported for those of you who follow the issue at home, the Hotel Azura in Sonoma, $8.8 million the state provided to buy that hotel. In Napa, $2.1 million to buy facilities. The Sebastopol Inn, $6.2 million, just for those three properties. The state is providing to your local communities to help you address homelessness in a way that is defined by how your communities want to address this issue. And it's all about providing stable solutions to homeless individuals so that they can better their lives, right? And that's what Homekey and that's what Roomkey have been. So we look forward to working with the legislature now that we can perhaps make some forward progress and continue and expand these programs. And that's really what we're going to be speaking to Senator Dodd and his colleagues about in the months to come, is how much more funding can we put towards these programs? The governor has proposed $1.75 billion to expand these homeless housing approaches. And we look forward to working with the legislature, never assuming support, but hoping to earn support from the legislature to continue these programs and continue to make positive change for the people of California. So those are our two big initiatives. I could filibuster and talk for hours and hours on this, but I want to allow my friend and colleague, Secretary Castro Ramirez, to have time as well. And certainly, Senator, I'm happy to answer any questions from listeners on homelessness once we get to that point in the program.
All right, Jason, thank you very much for that. I'm excited tonight to have our Secretary of Business, Consumer Services, and Housing Agency, Secretary Castro Ramirez. Welcome. Thank you very much for being here tonight.
Thank you. Thank you so much, Senator. Thank you for the invitation. As I was preparing for this virtual town hall, I was getting so excited because I love to connect with people and constituents. I think as we work in state government shaping policy and administering programs, it's so important for us to be grounded in reality and grounded in what's happening at the local level. And then of course I realized that it was a virtual town hall, so it was going to be a little different, but I'm excited and looking forward to hearing from your constituents and from the people that you represent. And specifically, I think tonight's conversation is about what we are doing in partnership with cities and counties throughout the state on addressing housing, homelessness, and really continuing to do everything possible to protect Californians. And so, as you mentioned, Senator, I have the honor of serving as the Secretary of California's Business, Consumer Services, and Housing Agency, a very large and significant agency that includes everything from the Alcoholic Beverage Control Department to the Housing and Community Development Department to the Cal Housing Finance Agency and also the Department of Consumer Affairs with 37 different boards and bureaus that represent over 100 different businesses. And so we basically touch the lives of almost every single Californian in our state. And so we recognize that this past year has been very devastating at a personal level in terms of family loss, devastating in terms of economic loss and the loss of jobs, but also devastating in terms of the impact that it has had from a housing perspective. As you mentioned, Senator Dodd, I think, prior to going into this pandemic, we were already struggling as a state with housing affordability and the housing crisis. And, quite frankly, this pandemic and this public health crisis has made the issue much more magnified and much more a sense of urgency. And I will share with you that as we continue to respond to this pandemic, when we think about housing or when we continue to work in the space of housing, we're looking at three broad areas. First and foremost, as my colleague Jason mentioned, we have to continue doing everything possible to ensure that we're providing additional housing options and shelter support for individuals experiencing homelessness. But we also need to develop permanent solutions to ensure that there is more housing available for individuals that need a place to call home. The second area of focus has been on ensuring that families and households that have been impacted by the pandemic and that have either suffered job loss or economic loss are able to stay housed, are able to stay in their homes, and are able to weather, right, this public health challenge and also the economic, challenges, that come with COVID-19. And so we have been very much focused on ensuring that there are eviction protections and also rental relief. And so I will focus most of my remarks in this space. But the third piece that I don't want to lose sight of is, in many ways, I think that when we address, the situation that we're in with this pandemic, we are very much doing everything possible to protect and respond with a sense of urgency, with a sense of ingenuity, with a sense of working in a collaborative spirit. But we are also laying the groundwork and the foundation for not just individuals to be able to survive the pandemic, but individuals to be able to thrive as we come out of this recovery. So from a housing perspective, we have continued to do everything possible to remain focused on building a housing finance system that enables us to preserve housing affordability and produce more housing. So that's, that continues to be a focus of the state. And I, just wanted to not sort of lose sight of that. From the perspective of the importance of helping families stay housed, as you mentioned in your opening remarks, the legislature has been leading, along with the governor's office, an effort to ensure that renters and landlords that have been impacted are able to avail themselves of protections and also rental relief. And just about 2 weeks ago, the governor signed into law Senate Bill 91, the COVID-19 Tenant Relief Act, that enables renter protections to be extended through June 30th of 2021. And coupled with that, the act also provides for the state's rental assistance program to be established, leveraging and really deploying dollars that are coming in from the federal government through the U.S. Department of Treasury. As a state, we are estimating about $2.6 billion will be coming to the state of California, both to the state and local jurisdictions. And we are working in earnest to stand up the program that will enable renters to receive rental assistance and rental support to pay back rent. And of course, we can't do this without property owners, without landlords. And so we're working very closely with the landlord community, with tenant advocates, with a number of different stakeholders as the state develops the rental assistance program. Our goal is to have this rental assistance program in place by March 15th, by mid-March of this year. And so we will ensure that your office is aware of, as we get closer to launching the application portal to get information out. But in the meantime, I would like to share with members that have joined us today for this virtual town hall that if you are looking for information about the tenant protections and resources that are available to help keep you housed, I encourage you to visit housingiskey.com. Again, housingiskey.com. We have developed a number of resources and supports to ensure that if you're a renter or if you're a landlord needing help with how to navigate through these challenges that are impacting renters and landlords, that you're able to receive that level of support. And again, I mentioned that the rental assistance program, we're looking to stand that up by mid-March, and we look forward to sharing additional information. The last piece of resource that I would share, Senator Dodd and members that have joined us, is there's also a program that is being administered by the Cal Housing Finance Agency that is focused on supporting homeowners that also have been impacted by COVID-19 and are having challenges meeting their mortgage payments. There is a 1-800 line that is available to help homeowners that are struggling with making their mortgage payments. We have about 80 HUD counselors that are available to assist and walk through questions and provide counseling services. And so if I may, I'm going to go ahead and provide that number now. The number is 800-569-4287. And I'll repeat it one more time, 800-569-4287. And so I think with that, I welcome the questions from the audience and look forward to the conversation. So again, thank you so much, Senator Dodd, for the invitation.
Thank you. Thank you all. You've been so thorough. You've covered many of the questions that we have had. We had questions such as, what is the legislature doing to help people keep people housed during the coronavirus pandemic? Okay, so you're helping tenants. What assistance is there for small landlords may be in jeopardy of losing their properties when tenants don't pay them? I think we just covered that. We do have a caller. We are open for calls. The phone number is 707-933-9133, 707-933-9133. And let's just start off with Ken from Vacaville, who's got a question about the vaccine rollout. Ken, you're on. Hello, Ken.
Ken hung up.
He hung up. Okie dokie. One question that I was trying to pay attention, but hopefully I didn't miss this. For Senator Dodd, I don't know what this is about, quite frankly. What is being done to end the EDD fiasco?
Well, let me start there. I don't think there's any person that works for the state of California that's particularly proud about, what's gone on with the EDD. That said, when you start thinking about how impacted EDD has been by probably 7 to 8 times more people on unemployment than have ever been on unemployment before, it's totally overwhelmed. I will say though that my staff, and I'll tell you, I'm so fortunate to have, so many people that are working on my team in my 4 district offices. We stand ready to help. So if there's anybody out there that still has some issues with EDD, has not gotten the benefits they think they deserve, or they've gotten stonewalled, we want to help. So please call any of my district offices, whether it be Santa Rosa, Vallejo, Napa, or Vacaville. We can help, but it's just one of those things that has not been particularly a positive soundbite for any of us. But we're still all working hard to make sure that those people that are due those benefits get the benefits they deserve.
And I'll just, if it's all right, Senator, I'll just add,
Please.
From the perspective of the governor's office, certainly we're not happy with the level of fraud that's taken place in this program. In California, we are experiencing levels of fraud that are commensurate with the rest of the country. And I don't say that to brush off the question. I say that to make a point, which is every state in America is dealing with massive levels of fraud. And this fraud in the EDD system is well beyond, Rick Wynn claiming more benefits than he's owed. We're talking about organized criminal conspiracies emanating out of foreign countries. And if it sounds like some crazy conspiracy theory, trust me when I say this is very, very well organized criminal fraud. So unfortunately, in the Trump administration, we did not have a partner who helped us sort of combat that fraud at that level. And we're very happy to have President Biden in office, who is working with us on these issues and thinking about how to combat this criminal fraud more directly. But long story short, we need to do better. Long story short, we need to serve constituents better. Long story short, we need to get benefits to people faster. And it's, of course, a balance between preventing all fraud and getting benefits out to Californians who need them. You move too quickly, you potentially invite some of that fraud. You move too slowly, you leave folks without benefits. And so trying to hit that sweet spot is what we have to strive to do. We obviously have not done as good a job as we should have. And we're committed to doing better. But we're up against something very serious here, which is a multi-billion-dollar international fraud scheme, dark web, stolen Social Security numbers, all the sort of things you would imagine. And it's a law enforcement mission as much as it's a benefits paying mission. So we're committed to doing better. We have not done as well as we should. We're committed to doing better.
And as I understand it, the sad part about that is legitimate claims go unpaid.
We're working as quickly as we can to clear that backlog, but certainly, Rick, you've got a point there, and that's obviously something that we don't stomach, right? Because folks need that income, folks need that money, and everything that Secretary Castro Ramirez talked about, the rental assistance and all that, that helps, but you need that unemployment money, and we understand that, and we're very sensitive to those concerns. So, as I said, it's around striving for that balance between moving quickly, but making sure that people get paid the benefits that they're owed.
Thank you. We have Lanita on line 1 from Fairfield. Lanita, you have a question?
Hello?
Lanita?
Yes.
Okay, we'll go to, I guess we'll go to Scott from Sonoma on line 2.
Hello?
Okay, Lanita, okay.
Lanita.
Hi, Lanita.
Hello?
Go ahead.
Yes.
You're on.
Yes, I do. Hi, my name is Lanita. I'm living in Fairfield, and I have a question about the project Room Key.
Sure, I'm happy to answer.
Sure.
Go ahead, Anita.
Hello? Hi.
Hey, we're here.
Can you guys hear me now?
We can.
Yes.
Okay, I'm sorry. I had a question about the project Room Key.
I'm happy to answer. Go ahead.
Okay. I'm involved with feeding the homeless through a church here in Fairfield. And we've been participating with an organization that has been working with Project Room Key. So my concern is it's a very good project, but what is the quality control? Making sure that the people that are involved are doing the best that they can for the homeless community and not just in it for the money.
Thanks, Lanita. First of all, let me say thank you for working with people experiencing homelessness to make sure that they have the dignity of a meal. So thank you for what you do for your community. The question around quality control. So the Project Room Key hotels, and there are several hundred of them around the state, are run by local community-based nonprofits and local social service departments. So the state itself does not run the hotels. Various nonprofits and various government entities run those hotels. So in terms of the model, the service model, how folks are served in those hotels, it varies from hotel to hotel. But what should not vary is the dignity that people are treated with when they're in those rooms. The fact that their humanity is respected and acknowledged. The fact that they're provided hot meals and laundry service and regular custodial. The Project Room Key hotels do include what we call in sort of bureaucratic terms, wraparound services. And that's a fancy way of saying we want to make sure those rooms are clean. We want to make sure the heat and the hot water works. We want to make sure that folks are able to access meals and all the things that are basic to living. And that's standard across the entire state. So while each hotel operates a little bit differently because of who actually runs the hotel, one thing that should not be different is that standard of service and making sure that people's humanity is respected. Because at the end of the day, you're not a homeless person, you're a Californian experiencing homelessness, and you deserve that respect, and you deserve that from us.
Thank you. We have Scott on line 2 from Sonoma.
How y'all doing? So I have a question for Jason and the senator, I guess. I'm working with an organization here in Sonoma called HAS, and we are trying to eliminate homelessness. But one of the things we're working on short term is a winter shelter for about 10 to 20 people. The organization that was doing that dropped it without an alternate plan. So we've been trying with various hotels, churches, and everybody we can think of asking to find a place to house a few people for winter shelter. And we're kind of running up against a dead end here on that. The second project we're working on is finding a piece of property to put a service center and housing model. There's a model we're using as an example, or as a model, is an organization called Homeward Bound in Novato. And we have a builder here in Sonoma who's hired a young man who's homeless, and they're building prefab units. They're called Quick Haven. They've got 10 by 7 units for one person that can be put up in an hour and a half. So we're looking for a piece of property, put up about 10 of these, get an office, get case management services going, job training, job placement, and things like that. So that's our long-term goal. But for the short term, if we can get some help dealing with hotels or getting rooms here in Sonoma, that would be wonderful. And if Jason in particular and the senator have a contact, so I can call you guys tomorrow morning and go into more detail on this.
Senator, if it's all right, I'll just respond to his question. So we got really good news a couple days ago from the federal government, and that news is that FEMA is going to pay for 100% of the cost of these Project Room Key hotels, at least through September of this year. So before we got that really good news, counties were sort of struggling month to month, not knowing whether FEMA was going to pick up the bill. FEMA was paying 75 cents on the dollar. So they were reimbursing 75% of the cost, but it was month to month. So, okay, it's December. We don't know if FEMA is going to pick up 75% of the tab for January. So counties were really struggling to look forward into the future and figure out what they could afford to do in terms of these homeless hotels. But you know what? Leadership matters and elections matter. And we've got President Biden in office now. And you know what he did real early in his term was say, we're going to pay for 100% of those hotels. We're going to do it all the way back to the beginning of the disaster. And we're going to do it all the way forward to September of this year. So, Scott, I don't know the particulars of the situation you described. Sounds like what you need is some winter shelter to help some vulnerable folks get out of the elements. My suggestion would be to get with the county and make sure that the county is aware, and I'm certain they are because we've been communicating with them. But get with the county and make sure they understand that FEMA's picking up 100% of these costs moving forward. And that's really the most cost-effective way for us to address homelessness during the pandemic, because we have such a great partner in the federal government and President Biden that they're going to pick up 100% of those costs to the county. So that would be my suggestion on that.
Jason, if I may, let me just also offer to Scott, the Home Key program is administered through our Housing and Community Development Department. And as we were working to stand up the program and work with local communities, we of course have a technical assistance team that is available and ready to continue working with communities, particularly as Jason mentioned, the governor has proposed additional funding to continue the momentum with Home Key. And so I'm going to share with you an email address if you'd like to send us a note, and we will make sure to connect you with the Home Key team at HCD to see if they can, sort of assist you in sort of navigating through the questions that you've just shared with us. So the email address, I hope you have a pen, is housing@bcsh.ca.gov. I'm going to say it one more time. housing@bcsh.ca.gov.
Is that an S or an F?
B as in boy, C as in, BC.
Cat.
S.
F is in Frank.
Okay, it's housing at boy, Castro, sister.
Okay,
housing.
Good. Okay. Thank you so much. We have Ken on Vacaville. He called back. Ken, you're on line 3. Go ahead.
Yes, thank you, Senator Dodd, for this venue. Question for Ms. Missouri on vaccine rollout. The plus 65 population that is now going to be the focus is not being communicated with. I live in a 55 plus community. 1/3 of our population does not have a computer. myturncalifornia.gov is not going to work. How can you reach out with phone calls to 65 plus, because that's what they need. They don't need websites, they need phone calls.
Thank you for that. Yes, we understand that there are those that don't have internet access or aren't familiar with using the internet. So there is a toll-free number that you can call in order to actually schedule an appointment or to find out more about the eligibility. That is 1-833-422-4255. Now that is in 8 in the morning to 8 in the evening, Monday through Friday, and 8 in the morning to 5 p.m. on the weekends. We also are working with community-based organizations in order to do more reach out to their constituency, to their communities. So that's actually beginning this week. So hopefully we'll see the fruits of that beginning next week. And point taken, and we will work to find many more varied ways to get the word out to the 65 plus community.
It is an issue. I worked at Sonoma Valley Hospital. I worked for 4 hours checking people in. Some people had flip phones when we asked them to scan a QR code or a code. And it is an issue for older people, especially 75 plus. Robert is on the line to ask about evictions from Vacaville. Robert?
Yes, this is Robert Ailman. Thank you again for having this forum. This is a great relief. My wife and I got a visit from our landlady a week ago, and she said she was going to evict us and that she was going to sell the house. My wife and I actually, I think, live in the same community that Ken does in Vacaville. We're seniors. My wife is an essential worker. She is a teacher in Napa County in special needs. I want to know if Senate Bill 91 actually covers us, because we pay our rent every month.
Yes, thank you so much. First of all, thank you so much for calling in and tuning in and sharing your story. You are protected under Senate Bill 91. As I mentioned, the eviction protections are extended through June of this year, and essentially, with as a renter, the obligation, of course, is if you're unable to meet your rent, you need to, of course, notify your landlord and ensure that there is an explanation to the property owner as to why you're having difficulty paying your rent. But it sounds like in your case, you are paying your rent. Is that correct?
That's correct. We have been in the house for 16 years. And as you well know, and this speaks to your affordability issue, mm-hmm. Almost all of the communities along I-80 from San Francisco to the foothills has skyrocketed. It's ballistic. It's the most seller-oriented housing market this region has ever known. Almost every community is suffering. And so, I understand she wants to sell now. But if we go out and look for a place right now, which we are doing, we're exposing ourselves to COVID. I mean, we've already heard how long this is going to take. We're still in a learning curve with COVID. So I don't know why it would be business as usual with evictions. Mm-hmm. Especially now.
Can I ask if you are aware of any sort of local legal aid organization in your neighborhood that you might be able to contact to help you sort of really to be an advocate for you? Because this sounds like it's a very different situation. You're making you're making your rent on time, and it sounds like your property owner is looking to evict maybe for other reasons. And what I would suggest is to be able to reach out to a local legal aid organization or an organization in your community that may be able to advocate and sort of provide support and additional sort of guidance as you navigate through this process. I would also maybe offer, if you don't know of an organization in your neighborhood, if you call the 211 info line, they have really incredible resources in terms of being able to connect you with legal aid, tenant advocacy organizations. So again, just dialing 211 if you don't know of someone in your neighborhood.
Thank you. We have Eric on from Petaluma on line 2 with a question about the vaccine allotment for people with disabilities.
Hi,
Eric?
Thank you very much, Senator Dodd. I sent an email earlier when I heard that this program was coming on and had not heard response, so I wanted to ask you and the panel in general. I'm a healthcare professional. I work in the emergency room in the county hospital, and so I was fortunate enough to get a vaccine. My wife has cerebral palsy, and according to the state of California, cerebral palsy falls under the auspices of high risk, and there are many others that I would assume that fall under the same category. We are having difficulty getting the vaccine for my wife. We are having difficulty getting the vaccine for my wife through her employer. She has Kaiser, and we went through Kaiser and were denied. We went to the county that she works in and were denied. We went to the county that we live in Sonoma County, and we found out that Sonoma is not offering the vaccine. They do acknowledge that she is high risk. And we went to a private organization that acknowledged that she's a high risk, but is asking for a waiver. And this waiver, I'm assuming, is a Medi-Cal waiver. And I looked all over the place and could not find anywhere where you could get a waiver. We have received a letter from her doctor saying that she does have cerebral palsy, but by this private company, we have been denied her getting the vaccine. And I'm wondering if there is a way for those people with disabilities that they can get a vaccine and not have to go through as much red tape as we've had to jump through. Thank you.
Everybody hold for a second, please. KSVY Sonoma.
Little legal thing there. Who'd like to take that question?
I can take that. I can start that. So Eric, thank you so much for sharing with us your situation. And this is a situation that's shared by many others. And for that reason, the state of California is looking at the possibility of including, for lack of a better word, exceptions to the phased eligibility for vaccine. And they're vetting that information publicly through the Community Vaccine Advisory Committee, the CVAC. If you're not aware of what this group has been doing, you can go onto YouTube if you have internet access. All of their meetings are loaded there. And they meet every other week on Wednesdays. So they met last week to discuss just this topic. And then we have a drafting guidelines work group within the California Vaccine Task Force that will then hear the committee's recommendations, come up with their recommendations to make to the governor. So right now, I understand the tough situation you're in, and I would encourage you to continue the dialogue with Kaiser. But if and when these new guidelines are put into play, And if in fact they do make your wife eligible, then again, reach out to Kaiser, reach out to your local public health clinics, and work through them in that instance. I cannot give you a date certain when that those guidelines will be put into place, and I can't give you certainty right at this moment that that cerebral palsy will be a determining factor for that exception. But they are looking at those disabilities that are at the highest risk. So hopefully that will give you something to look forward to keep apprised of, and I can let Senator Dodd know when that guidance comes out, so you can take a look at that.
Okay, we're about done here. Thank you all so much. Senator Dodd, there was one question. I hope it's not. I hope it's not a long answer. If it is, then we don't really have to address it. But it was sent in from David Rossi about how do you intend to negotiate with the teachers union on an equitable date for California schools reopening?
Well, this has been, certainly a challenge, as we've seen the San Francisco Unified School District being sued by the city of San Francisco. Only in San Francisco could you see that type of dynamics. But, it is important. We need to get our kids back to school. The science suggests that this is acceptable, and we need to move forward. And I support, frankly, the governor's proposal that he had put forward. That said, I know that they're negotiating right now, and we'll probably hear in the next, in a very short period of time, what the results of those negotiations are. I got a little briefing today, but not enough to really be helpful here tonight. But rest assured, just like everything else we're talking about, we are, a lot of the answers are, still up in the air. We're re-engineering this plane in flight, and it's not easy. Nevertheless, I just think it's important to talk about it. We have teachers that don't feel safe, even though the science suggests that they're going to be okay, but particularly small kids don't, transmit, COVID. But nevertheless, those that want to come back with a vaccine. We all want the vaccine. So I think we're going to see a lot of these things play out in the next week or two. And so Film at 11, I'm sorry, I really don't have the total answer there. But Rick, I think we're going to close tonight right now, or unless you have something else.
No, we are. But I do want to say that I know you want to get all those dozen grandkids that you have back in the school.
Yeah, I do have. I have 10 grandkids, and 8 of them are in the public school system. 2 of them are in the private school system. Frankly, those that are in Napa, which are about 6 of them, are going to public schools that have been open, that they've been open since September. So it can happen. They've done a fabulous job. I want to give a shout out to the Napa Valley Unified School District, to their administrators, the teachers and everything, for showing up and making it happen. We also need to say, because like in Sonoma County, our teachers there haven't had the opportunity, our school districts have not had the opportunity to open because they've been in the purple tier, all this time. So look, at none of these excuses. I mean, it's kind of like EDD. They're not pretty. We wish they'd be different. We wish everybody was in school. But I think, we got to look forward to this, our vaccines, and making sure that everybody's healthy, moving forward. So it's going to get better. To everybody there, I really want to thank our governor for stepping up to the plate, bringing on, I don't think he blessed these 3 wonderful public servants that we have on tonight to come on this show. But I'll tell you what, I really think he's been doing a phenomenal job. This is not easy. None of these situations were of his doing. And it takes leadership, and it takes people to step up and, put their best foot forward. I believe he has. Things will get better. So with that, first of all, what I'd like to do is thank all of the people out there that listened tonight, that called in. If you have any questions that you weren't able to because of time, please call any of my district offices. That's Santa Rosa, that's Vallejo, that's Napa, and Backville, or Sacramento, our capital office, and get your questions answered. We want to help. I'd like to thank our three panelists for just doing a tremendous job. You honor me by being on with me tonight. Thank you for your service to the people of the state of California. And Rick, thank you for your service. This is the KSVY seventh time, your sixth time, not of your own doing, that you weren't here on the that one other time. But thank you very, very much for all that you and KSVY do to make this all happen. Thanks to everybody, and have a good evening.
Thank you, Senator.